very important person today here with us because Banega Swasth India really is about making India truly healthy. We have with us Dr. Shyam Bishen. He's the head of Center for Health and Healthcare World Economic Forum. It's a pleasure to have you with us, sir. You know, to begin with, I think AI, the theme this year is also intelligent age. How do you envision AI when it comes to healthcare, or would you like to share any best practices which you really think have brought about a change?
Yes, first of all, thank you, Ambika. Thanks for having me on your show. It's a pleasure to be here. It's a really important question. As you know, the overall banner for our annual meeting here in Davos is collaboration in intelligent age. So AI is front and center. So AI in our area, in our center of health and healthcare, is such an important topic for discussion here because we do see that AI can completely transform the healthcare. So it's not only going to change a few things here and there, but it's going to completely transform the healthcare. We are looking at using AI to create better access, better health equity, better outcomes from the health delivery, as well as gain more efficiencies. So we are actually exploring AI as a transformational tool for healthcare.
When you say transformational tool for healthcare, do you think AI can help bridge the gap about, covering, bridging the gap when we talk about universal health coverage, achieving health for all by 2030, the UN agenda?
Yes, absolutely. I do believe that AI can help us achieve that SDG goal, because AI can bring us, different ways to think about creating access to people who are in rural areas, to people who are in low and middle income countries who don't have access to healthcare now. AI can help us democratize healthcare. So we do believe that AI is a good tool for that. We just have to make sure that we have the right infrastructure for AI. We have to make sure when we are doing innovations, those are cost effective. So there are a few things that we have to keep in mind. One is the infrastructure has to be there. The second one is the innovation has to be cost effective. And the third one is that we want to make sure that there are right regulations, right guardrails for use of AI. So there is a responsible use of AI and not misuse of AI. Yeah.
When you say responsible, that's the next question which I really wanted to ask you is about sensitive patient data. Obviously we're using AI is helping in a lot of things, whether it's diagnostic, prevention, checkups, and But do you think how can that data be kind of taken care of?
Yes, that's a very important question, Ambika, because health data is private.
Yes.
Privacy issues have to be considered anytime you're dealing with somebody's data, which is related to their health conditions. So we have to make sure that overall health data is protected. There has to be several systems in place to protect the health data. Obviously, cybersecurity and other things we are working on, those are important. But I think the health system has to be made foolproof. In our initiative, in the Digital Healthcare Transformation Initiative that we have within the Center for Health and Healthcare at the forum, health data is one of the legs, for overall, digital healthcare transformation. First thing, we want to make sure that the health data is accessible. It's, we have the right guardrails for that, and there we can solve for interoperability and regulatory problems. But most importantly, to your point, we want to make sure that the health data is secure and it's being handled in a proper way.
I think absolutely important what you said. Again, digital health solutions technology.
Yes.
What role do you see of telemedicine and other ways of digital health improving or helping access for health for all?
Huge role. Telemedicine, telehealth has already played a big role during COVID.
Yes,
during COVID, and India is showing the way. We do see e-Sanjeevani program from India coming out, which has already reached out over 300 million patients. We think that this is something that we can explore and scale up further. And AI will be, again, a big help there in terms of creating virtual hospitals, for example, making sure we can get early diagnosis for people who are living in, in small towns or small villages or rural areas of low and middle income countries. So I think AI can, again, help us further expand and further scale up telehealth, telemedicine. Yes.
Great.
Yeah.
So AI does play a very critical role, but at Davos, I think something which I really want to ask, and we cannot not talk about this, besides, of course, AI, technology, climate change.
Yes.
We are witnessing it.
Yes.
This year at Davos is not as cold what it used to be. I've also heard the snow is lesser.
Yes.
The impact on health, climate change, what would you say about that?
It's huge. The impact of climate change on human health is a big area. We have launched an initiative actually on this particular topic in 2024, where we are looking at how climate change is impacting, first of all, various disease areas. Vector-borne diseases, mosquito-borne diseases, other infectious diseases, respiratory, poor air quality. I mean, you see the air quality in Delhi and other places in India. How that's causing respiratory and other diseases. It's also impacting cardiovascular disease. So our point from our initiative is to make sure we understand, how it's impacting these various diseases, including mental health with extreme weather events. And then how do we make sure that we come up with strong, really good adaptation strategies, not just look at the mitigation strategies. Obviously, you have to decarbonize and we have to lower the carbon emission. That's the first thing, that to take care of the health of the planet, but we should not forget the health of the human beings. And that's where I think adaptation strategies, the preparedness of the system, that comes in picture. So we are working with both public and private sector, with philanthropies, with Wellcome Trust, Gates Foundation, Novo and others, as well as private sector, to make sure that this is an area that gets highlighted. I was in Rio for the G20 Health Ministers meeting a couple of months ago, and there we have put climate and health on the agenda so that the governments, the G20 governments, are paying special attention to this. But I think the only way we can solve this is through innovation, through use of digital technologies, through use of AI, among other things.
I think what you said is really, really critical when you say, the interconnectedness and, what all is being done. Obviously, it's key. It's affecting each one of us. We have a campaign called Banega Swasth India, which is now in the 11th year, longest running public health campaign on television. And it also talks about the role hygiene plays. And we've seen it in COVID. We've seen it even for other, pandemic after pandemic. How important do you think is the role of hygiene when it comes to one health? When we say health for all.
Yeah, it's very important. I think hygiene plays a big role, especially when you talk about infectious diseases. And we saw that during COVID, as you said. So hygiene plays a huge role. We want to make sure that people are doing basic stuff. And one of the basic stuff is just washing your hands. So you make sure that you wash your hands with, proper antibacterial soap for at least 60 seconds before you eat or before you use your hands on your body. So I think it's important to make sure that, we highlight hygiene through your Banega Swasth India campaign. Yeah.
Well, it's really been a pleasure to talk to you, and thank you so much for being a part of NDTV.
Thank you, Ambika. Thanks for having me on your program again.
Okay, I'm going to take 30 seconds. I'm going to do a quick rapid fire.
Okay.
Okay, that's going to be fun. Okay, Dr. Bishen, are you ready for the rapid fire?
Sure.
Okay, my first question. If you could wave a magic wand and fix one climate problem, what would it be?
So the one climate problem to fix would be to make sure that we create good strategies to mitigate and adapt.
So mitigate and adapt strategies. Okay, what's your go-to climate-friendly habit? Recycle, compost, or something quirky? Let's hear it.
Recycle.
Okay, that's an easy one and a good one, actually. One superpower for fighting climate change you wish individuals get?
Well, if you could decarbonize everything, make sure that whatever you do is sustainable.
Okay. Yeah. Okay, now if you could teach everyone one thing about climate change in 10 seconds, what would it be?
Well, pay attention to what you're doing, again, to your activities. Make sure all of your activities are sustainable.
So I'm going to ask you a little bit about Banega Swasth India, how initiatives like this can educate communities, and a message for the campaign.
Yes, pay special attention to hygiene, making sure you wash your hands.
Okay, last one, your message for individuals, policymakers, and the government when it comes to climate change and health for all.
It's public-private partnership. Make sure that we all come together, create multi-stakeholder coalitions to tackle these problems.
So coming together, collaboration, Jan Andolan.
Yes, absolutely, it's a collaboration.
Lovely speaking with you. Thank you.
Thank you, Ambika.